Pentamidine, when given through inhalation, is used to prevent a serious lung infection called Pneumocystis pneumonia, PCP, in people with acquired immunodeficiency syndrome, AIDS. This medication belongs to a class of drugs known as antiprotozoals, and it works by killing the organism that causes the infection. It is important to use this medication as directed by your doctor to get the most benefit from it. The dosage and timing of Nebupent Vial for Nebulizer will depend on your medical condition and response to treatment. Be sure to follow your doctor's instructions carefully. If you have any concerns or questions about this medication, be sure to discuss them with your healthcare provider. This medication is administered by a healthcare professional, usually once every 4 weeks, using a nebulizer machine. The nebulizer changes the solution into a fine mist that you inhale, and each treatment typically takes 30 to 45 minutes. You may also receive another inhaled medication, such as albuterol, to help open your airways before each pentamidine treatment. It is important to follow all instructions for using this medication and the nebulizer. The dosage of Nebupent Vial for Nebulizer is based on your medical condition and response to treatment. It is important to use this medication regularly to get the most benefit from it. To help you remember, mark your calendar to keep track of when to schedule the next dose. If you develop symptoms of infection, such as breathing problems, cough, or fever between treatments, it is crucial to inform your doctor right away. Some common side effects of Nebupent Vial for Nebulizer include cough, upset stomach, loss of appetite, nausea, vomiting, diarrhea, dizziness, headache, burning feeling in the throat, or unusual taste/dryness in the mouth. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks of potential side effects. Many people who use this medication do not experience serious side effects. However, it's crucial to contact your doctor or respiratory therapist right away if you experience any serious side effects such as chest tightness or breathing problems. While it's unlikely, inhaled pentamidine may be absorbed into your body. Contact your doctor immediately if you experience any serious side effects such as abdominal pain, easy bruising/bleeding, fast/irregular heartbeat, mental/mood changes, signs of kidney problems, signs of anemia, signs of low blood pressure, signs of low blood sugar, signs of high blood sugar, signs of infection, or any other serious symptoms. A serious allergic reaction to this drug is rare, but if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects, so if you notice any other effects, contact your doctor or pharmacist. In the US, you can call your doctor for medical advice about side effects. You may also report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, call your doctor for medical advice about side effects, and report side effects to Health Canada at 1-866-234-2345. Before using Nebupent Vial for Nebulizer, it's important to inform your doctor, respiratory therapist, or pharmacist about any allergies you may have, as well as your medical history, especially if you have bleeding/blood disorders, breathing problems, diabetes, kidney disease, liver problems, or if you smoke. This medication may cause dizziness, and alcohol or marijuana can intensify this effect. It's important to avoid driving, using machinery, or any activities that require alertness until you can do so safely. Limiting alcoholic beverages is also recommended, and it's important to speak with your doctor if you are using marijuana. If you have surgery planned, inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. For pregnant individuals, this medication should only be used when clearly needed, and the risks and benefits should be discussed with your doctor. It is also unknown if this medication passes into breast milk, so it's important to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions when using Nebupent Vial for Nebulizer. This medication may affect how other medications work, and could increase your risk for serious side effects. Be sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this information with your doctor and pharmacist. It's crucial to always consult with your doctor before starting, stopping, or changing the dosage of any medicines. This will help ensure the safe and effective use of Nebupent Vial for nebulizer, and minimize the risk of any potential drug interactions. Always follow your doctor's guidance for the best results. If someone has taken too much Nebupent and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help by calling 911 or the Poison Control Center. In the U.S., you can contact your local Poison Control Center at 1-800-222-1222, and in Canada, you can call a provincial Poison Control Center. This medication should only be used as prescribed by your healthcare provider. It is important to follow all instructions given by your doctor and to attend all scheduled medical and lab appointments. Do not share this medication with others, as it is prescribed specifically for your condition. Make sure to take each dose of Nebupent Vial for nebulizer as directed by your doctor. If you happen to miss a dose, be sure to consult with your doctor or pharmacist to determine the best course of action. Make sure to store Nebupent Vial for nebulizer at room temperature and away from light. Once the solution is mixed, be sure to use it within 48 hours and then discard any leftover solution. It's important to keep all medications out of reach of children and pets. When it comes to disposing of Nebupent Vial for nebulizer, never flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, make sure to properly discard the product and it is expired or no longer needed. If you're unsure of how to do this, consult your pharmacist or local waste disposal company for guidance. And remember, always follow the recommended dosage and schedule for taking this medication to ensure its effectiveness. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.